We are so glad that you have tuned in again to the Black Fatherhood podcast series, a collection of videos covering a spectrum of interlaced topics related to Black fatherhood. I am Dr. Alvin Thomas, Assistant Professor in the School of Human Ecology at the University of Wisconsin-Madison. Black Americans make up about 13% of the US population, and of that, over 16% report experiencing some form of mental difficulty over the past year. That's more than 7 million people. While we continue to learn more about men's mental health, especially in their role as fathers, this much is clear. Fathers, like mothers, are vulnerable to depression in the period surrounding the birth of their new baby and throughout their parenting role. And paternal mental health problems can have serious consequences for children and families. In fact, men experience as much as 68% increase in depression symptoms in the first 5 years of fatherhood, which in turn can negatively affect parenting, family relationships, and child development. We also know that many Black fathers, especially those working in high-risk conditions during the pandemic, experienced higher levels of anxiety and depression, and the effects spill over into the family. Unfortunately, many men may not be attuned to their own mental health or understand its implications for them as fathers, nor be aware of or have access to the necessary available supports. So today we are here with our guests to expand the conversation on mental health and its effects, particularly to Black fathers and their families. We are here with the overarching goal to educate, validate, and elevate Black fathers. Joining me in discussing this episode's topic are Dr. Britt Gayle, MD, a family medicine specialist with training in global health research initiatives and HIV primary care. Mr. Darryl Davidson, the director of the City of Milwaukee Health Department's Men's Health Unit, where he oversees all program activities related to improving the health of men in the Milwaukee community, and is responsible for the development and funding of the Men's Health Center. He has deep connections in Milwaukee and is a well-known advocate for the health of Black men and families. And Mr. Eric Crawford, a therapist and doctoral student at the University of Wisconsin-Madison, where he studies mental health and specifically the health and wellness of Black men and Black families. Thank you very much, gentlemen, for joining me.
Thank you.
So I'd like each of you to take a moment, take a few minutes, maybe a couple of minutes, to say a little bit more about the work that you do and how it has specific relevance to Black fathers. And either of you could jump in first.
I'll start off.
Yeah.
In my role with the City of Milwaukee, I'm also the director of the Milwaukee Fatherhood Initiative, and that has a connection to multiple facets of the relationship between fathers and families, fathers and communities. And our goal is to engage fathers so that they see the role as being not only important, but essential to the development of our community and take the leadership role seriously in their relationships. We do have an issue related to fatherhood and mental health. Many of our fathers who are part of our programming have not seen fathers in their families when they were growing up. Primarily, our fathers are approximately 80% fathers of color. So there's variety of histories that go along with that particular demographic. We do have fathers that come from specific cultures where they did not engage with their children as part of the cultural dynamic. But then we also have those fathers who, in some cases, did not see fathers in the neighborhood. Ultimately, we want to make sure that they know that their role is not only important, but it's something that they can pass on those characteristics to the next generation. So I'm happy to be a part of the discussion, especially because many of those fathers take it upon themselves to create what they imagine to be the fatherhood role. And in some cases, without guidance, that is not a very positive outcome that comes from it.
Excellent. In another discussion, we talk about what that fatherhood role looks like and how people with fatherhood role, and maybe, like we said, that this is an interconnected, interlaced set of discussions. Maybe that might come up as we continue talking about mental health and the overlap of the fatherhood role. But either Britt or Eric could jump in now.
Okay, I'll go. So yeah, so I am a family physician who is practicing as a family physician, HIV specialist, and clinician investigator in the Baltimore area. So a community that has a very large Black community. And as a family physician, I have the unique privilege of being able to interact with essentially all members of the family unit. And I continue to do that on a part-time basis. So therefore, we're able to observe interactions amongst members of the family, from the child to the mother to the father, as well as sort of identify and address various challenges that members of the community may experience. And as we all sort of know, those challenges, those stressors, those mental and physical health issues end up impacting all members of the community, though it may manifest in a variety of ways. Moving on to the research side, the majority of my research focuses on both hepatitis C and HIV within the community of individuals with opioid use disorder. And part of our research essentially investigates the various biopsychosocial factors that influence not only one's current state of health, but then also some of the risk factors that actually sort of contributed to the current stressors that they're experiencing. Most notably, most recently actually, is the assessment of adverse childhood events and their role in patients' current challenges with opioid use disorder.
Excellent. I know some of you might be wondering, well, why, if we're talking about mental health, why do we have a medical doctor here? Well, for the very same reason that he just mentioned, the idea of the biopsychosocial model, the way our mental health affects our physical health, and the way our physical health can affect our mental health. But again, we're going to expand into all of those hopefully as we go through. Eric.
So greetings. I'm Eric Crawford, a current doctoral student in the counseling psychology program at UW-Madison. Prior to my doctoral program, I worked as a counselor and therapist in Atlanta, Georgia, working primarily with Black men and boys and their families. And so now what I am pursuing in terms of research in the doctoral program is really just more focused on those two particular groups, specifically Black men and boys, as well as the how parenting affects that health outcomes of those individuals. One as the offspring, and also the father, and how the fathers, Black fathers specifically, are impacted from parenting, the parenting processes, and the different intersecting areas. So you have society, therapy in general, engaging fathers in therapy, and then also in other systems within the within their community. I'll talk about more details in that potentially as we go on. So
we'll look forward to that. So I know I could do a really quick Google search and can yield a number of answers, but I think I'm a little bit interested in hearing how your answers to this question might differ and how they may overlap in some cases. When you think of mental health, what is mental health to each of you? And maybe Darryl will start with you, and then we'll circle back.
Well, mental health is the final part of the comprehensive health of an individual. Mm-hmm. So it is the aspect that allows people to be conscious and understand what is going on in the world and how they respond to what's going on in the world. Mm-hmm. So an individual who is in optimal mental health would be able to communicate what's going on inside of them to the external, as well as be able to process what's external into themselves and then navigate appropriately through those environments. Most of the time, in my experience in the job that I'm in, we often are working with people who don't have a solid definition of mental health. And so they speak from a position of illness or sickness or what may be a disorientation. And then they try to establish, well, what was my optimal mental health state? But in reality, it's no different than really knowing how it is with your physical health, knowing when your body breathes well and when you are able to move without pain. Mental health is in a similar fashion. If it's optimal, then it's functioning correctly and effectively.
So you said at the beginning, and maybe you meant it, maybe you didn't, but you said it's the final part of optimal health.
Yes, I consider it to be the final part because it's the part that glues the other elements together. So for example, if someone has their physical health, it's not exactly connected to what they're conscious of. A person can be in optimal physical health when they're sleeping. So they're not thinking about it. And then if a person is attached to whatever form of spirituality or spiritual health, they have balance. They can attach an emotional balance to their lives based on there may be things that are entering that they typically would find themselves to be fearful or maybe not comfortable with, but they have some type of foundation. It doesn't have to be the same thing in everyone, but some foundation where they can find themselves at peace and then move forward. And the glue with that part, as well as the aspect with the physical health, is that mental health side. It seems that all of that is needed in order to make a person complete, whether they're conscious or unconscious.
Yeah, I like that analogy that mental health ends up being that glue that holds all the rest of these other pieces together. Thanks very much for that, Darryl.
And if I can interject and just extend, I like that as well. I agree with your description of it. And I would just, I guess the way I would say something similar is mental health is this, it is a person's psychological and emotional ability. Oh, it's a reflection of a person's, an individual's assets and limitations or deficits. I think you have to reference both mentally and psychologically, or psychologically and emotionally. And I love something that Darryl said. He said it's a person's ability to respond. I think it's a person's ability to respond to context. So whether that they're at work, home, or just out in the community, there's a person's ability to respond appropriately to each given situation and context that they're in. And there are some things I think that can be improved because I think we and built upon in terms of mental health. But then I think there are some things that I want to say Darryl, Mr. Davidson was referencing this as well, that we just need to be aware of in ourselves. And then our goal then is not necessarily, it may not be improvement, but then how do I navigate the context with what I'm bringing to it? How do I navigate the context with these assets or these deficits that I may have? I know I probably went beyond your question, but I do want to, so it's, hold on, might have to edit this out. It is of individuals' psychological and emotional deficits and assets and the things that they're bringing to context, as well as how they're responding to that context.
Excellent. Britt, do you want to add anything to that?
Sure. I'll attempt to give the more layperson definition. I guess I would sort of define it as one's ability to navigate or manage the everyday demands, challenges, or stressors of life in an appropriate or functional manner. I sort of envision it actually to be not too dissimilar from physical health, where, as we've sort of already discussed, one has that baseline of resilience or susceptibility, depending on one's sort of baseline state of health. And then that has an interaction with the hazards or the challenges that one may experience. So, for example, to use a physical analogy, one may be in great shape, but if one is in an area with poor air quality, that's still going to result in worse outcomes compared to somebody with even perhaps comparable baseline level of health and maybe even slightly worse baseline level of health, but who is in an environment that is less hazardous. And I think that is directly relevant to the mental health of many Black fathers in the Black community, where oftentimes they have to exhibit a higher level of resilience just to navigate the hazards and the challenges that they're encountering. And when they face those challenges, they have to somehow devise a functional way of navigating those challenges. And unfortunately, far too often, those susceptibilities that we sort of referred to interact with those hazards and oftentimes result in the selection of dysfunctional coping mechanisms.
So I like how all of, thank you very much for that. I like how all of you have pulled in these multiple elements. There's the situation, there's the attempt to respond appropriately and adaptively to the situation. There's the bringing in of the advantages or the assets that the individual might have, but also some of the potential underlying deficits or challenges that the individual is bringing in, and the attempt to be resilient in the midst of all of this that's going on. And so a lot of this is happening inside of the individual, which is what we usually think, but I like how most of you have, or all of you have attempted to expand it beyond the individual and talk about how the environment kind of influences what it looks like when an individual exhibits mental health. And so as we talk about the exhibition of mental health, what are some of the common markers or features of mental health, and how have these been, how are they continually manifested in our families and communities? So again, what are these markers or features of mental health? If somebody's saying, I have good mental health, I have bad mental health, what are they looking for to be able to say that they're looking at these features of mental health in their families or communities or in themselves?
If you don't mind, I just want to kind of linking it back to that original question too. And this is consistent with both Mr. Davidson and Dr. Gayle were saying. So mental health, I like it. I like this idea of a mental health as a glue, because if a person has two individuals have similar baseline physical health or spiritual health, or other aspects of health, mental health, individuals' mental health or ability to respond appropriately to context acts as a mediator of a sense or of a sort, and also in some places as a moderator in terms of just how that person's health, the trajectory of that person's health over time. An individual with poor or less than optimal mental health is more likely to decline in physical health or see declines in physical health. And so one marker, if you will, of less than optimal, I like that language, mental health is someone with declining health who may not take care of themselves. A simple one that, you may work with an individual in therapy is really just as basic as hygiene. Looking at it, how an individual just takes care of themselves. We don't necessarily think of it sometimes because you do have to consider the cultural norms in terms of how people care for themselves hygienically. But that is something you want to look at. If a person uncompared sometimes, but really, and we'll talk about the clinical ways of just approaching that and the topic around that, but looking at hygiene, body odor, in the other areas, I don't think I have to elaborate.
Diet and others.
So
I'd like to elaborate on something that Dr. Gayle mentioned also. A person with optimal mental health is also aware that the world does not revolve around them.
Right.
That's good.
They are clear about that concept. They also are aware that, just like with physical health where there can be conditioning and exercises and routines that can improve physical health, they would know that they're able to study and rest and do other things that can improve mental health also, aside from what we're seeing with self-medication that may take a person into a negative direction. There's things that are positive that would enhance mental health also.
Yeah.
So I'll go back to the self-medication aspect, sort of drawing from some of my experiences in addiction medicine care, and going back to the question of how do we sort of manifest good mental health, or how do we sort of identify someone who at least at that time is demonstrating good mental health behaviors. I'll go back to sort of how do we sort of deal with various stressors? How do we process the stressor, and how do we respond to that stressor? And so going back to sort of the concept of self-medication, it sort of reminded me of some of my patients who are sort of struggling with addiction in addition to whatever other mental health issues they're dealing with. They're already sort of almost at their capacity to handle those challenges, that when another stressor comes, perhaps one that isn't even perceived as being that challenging to someone who is in a better state of mental health, they're already sort of impulsively choosing a more dysfunctional option. So for example, I have a patient of mine who's dealing with multiple things, and he was actually with his son and studying for his learner's permit. And so he initially failed his the initial learner's permit test. And so most of us have all taken the learner's permit and driving exam before. We know that that can be stressful for anyone.
Right.
But for him, that sort of that temporary failure, which most of us would sort of place within context and say, okay, well, we can take this again, even though this is disappointing, that combined with already the other challenges he was dealing with sort of resulted in him feeling the need to sort of palliate that stress by using fentanyl or illicit opioids. And so I think that's sort of an example of sort of where a common stressor might be perceived quite differently and be managed quite differently. Going back to, once again, the physical medicine analogy, I think about one of the tests that we use for a lot of our patients, which is literally called a stress test. And so what's the purpose of a stress test? The purpose is you have two people who might look the same on sort of a superficial exam, even in a clinic, but you suspect perhaps that they might have something wrong with how their heart is functioning. Now, it might not be something so bad that it's readily evident on a daily basis, and it only becomes evident when you sort of push the heart to a higher degree of demand and a higher degree of performance than what's usually required of it. And so I think that's where we can oftentimes see when people can demonstrate good mental health or resilience versus perhaps, a lower or poorer mental health.
And I love what he said, just adding to and highlighting one marker that just trying to highlight a marker that he identified. Risky behavior is another potential marker you could look for. So like you've referenced, Dr. Thomas, some things are happening internally, and it's not always easy to see. Even looking at research, you recognize internalizing behavior is harder to measure sometimes, or even harder to identify. It's usually not the reason people or individuals are even seeking help. It's the externalizing behavior, so the things that are overt. But those they tend to be indicators of what's happening internally. So that risky behavior or self-harming behavior, sometimes markers within our community, and specifically with Black males in general. I think you look at attitude and just what Dr. Gayle said, look at the way they're responding to situations of someone who may be irritable or whose mood has changed, I would say drastically, or enough for it to cause concern from how they typically are. It's kind of complex because many of us, I believe, which I would say, are already walking around with this monkey on our shoulder because of just our experiences in daily life being Black men with all the things we're seeing on media. And so sometimes you have to separate from those, and also look at how those things are playing into Black men and Black fathers' behavior specifically. because normally, I guess under normal circumstances, or what would be optimal mental health, is being able to kind of separate and disconnect from those things temporarily to be able to function daily. And sometimes some of us have met or reached our capacity and aren't able to, and you can see it reflected in our behavior. I'm gonna say one more thing. Sometimes that's what I call nihilism, and this giving up of sorts and just allowing life to happen, because we got into this almost hopeless place, or sometimes it is a hopeless place.
And so actually I'll interject as well. You know, I think to sort of go back to the concept of nihilism, I think in some ways, once again, going back to physical stuff, but I think it's
keep going there.
A manifestation of like sheer exhaustion, right? You know, we know that literally, you know, we can become physically exhausted to the point where we want to do something we can't. And so I think that nihilism, like you mentioned, is a manifestation of the chronic stress, the chronic hypervigilance that individuals from our community experience. And in particular, of course, Black fathers experience due to those expectations associated with the role and due to the fact that we're supporting everybody else. And then, you know, as somebody who works for a virology institute, especially during the COVID pandemic, that nihilism was initially very hard to address because you don't really know how to sort of address that exhaustion. You can't, unfortunately, change their environment. You can't give them some of your energy, but you know that you sort of have to provide some source of inspiration or help them identify a source of inspiration in order to continue. And I think that's the most difficult part to really articulate, especially to members outside of the community, is that constant wear and tear associated with that hypervigilance. And then I think also when we're interacting with the wider community and wider society, we also don't get a break from the expectation of being a good representation of the entire Black community, right? Yes. Even when we experience failure or when we perhaps don't respond in an optimal fashion, we sort of feel like we're not only failing ourselves, we're not only failing our families, but we're now failing the entire community because we don't have the benefit of individuality in public perception. And so I think all of those things contribute, like you said, to that nihilism where the odds just seem so insurmountable that some people just are exhausted.
Right. So when we think about all of what you've talked about, a lot of that invisible stress that's wreaking havoc on your body and wreaking havoc on your mental health, often in ways that you aren't aware of. I think we're often more aware of the exhibition of stress than we are of stress. So we say things like, I'm feeling tired, when in fact what it is that we've been carrying these heavy loads, these burdens, and not recognizing how much it was weighing, not on our physical bodies only, but on our psyche. But we only recognize the physical element of it. So we feel physically tired, but in many cases we are emotionally drained. And so as we think about that, these invisible pieces, these invisible elements of mental health, why is this so important to talk about specifically for Black men? Why is this such a critical topic for Black men and Black fathers?
It's critical for Black men, especially Black fathers, because the manner in which they're interpreting the information that they're receiving from their environment and then acting on it, it can either be a benefit, their responses can be a benefit to their family and the people that they care about or the community, or it can be destructive. And so we have to be clear about what does this person see or feel, and then what is that response, whether it's an emotional response or whether it's a stoic response, but how do they react based on that response that they have? And what comes to me is, if our men are not learning from other men, if we're not having these conversations and communicating, and we're getting these negative images of ourselves, Black men, and the negative from the media, then it could lead to self-harm, or it could lead to violence against the person who's in our family, or violence against the person who's our neighbor, someone we know. So we have to at least have that established first in order to be clear about what will be the end result of how our community is going to look, because of how people respond to what are routines.
Yeah, thanks.
Yeah, so I think it's incredibly important for Black fathers in particular to discuss this, because we know that there is so much stigma surrounding solicitation of mental health care, in pretty much whatever form it may manifest, as well as, unfortunately, a normalization of some dysfunctional coping mechanisms. And I think that stems from being part of a community that has for generations had to deal with overwhelming levels of stress and, frankly, unreasonable demands, to the point where members of our community, we sort of give ourselves a little bit of a pass because we know how tough this barrier is. It reminds me, I was actually watching this special on Netflix. I think it was Michael Che from SNL. And so he described, he's like, well, back in the day, he's like, we described mental health as, oh, well, that's crazy something, crazy uncle, or crazy whatever. He's like, or the other version was, ain't nothing wrong with him. He's just got, and so I feel like those are the two extremes that oftentimes Black fathers face, is they know that if their expression of their frustration or anger or fatigue or whatever is too extreme, then they'll be labeled as an angry Black man, or they'll be labeled as crazy or whatever. But then the other aspect of it is, if they conceal their mental health challenges, then it almost becomes more stigmatized, and it's almost self-reinforcing, where they're encouraged to continue to conceal their challenges, and then it becomes there's nothing wrong with him, he just gets a little angry sometimes, or there's nothing wrong with him, he just gets sad for a few weeks, sort of disappears, and then he'll be back, he's always back. And in that way, we sort of stigmatize the solicitation of assistance while sort of normalizing these dysfunctional coping mechanisms that place people at risk for self-harm, or, heaven forbid, unfortunately, expressing their mental health challenges in a negative fashion in the wider society, where we know that there's a much lower threshold, and where expressions of frustration and anger are perceived as dangerous threats, right? I know one of the phrases that really stuck out to me during this most recent court case for Ahmaud Arbery was when one of the well, I guess we can now say convicted murderers said, oh, well, he seemed so angry. And he said that, and he was truly befuddled. And I was like, well, if someone's chasing you with a gun, and it's literally a fight or flight response, right. Yeah, I would consider that to be an appropriate response. But we know that, unfortunately, any expression of anger, whether warranted or not, actually places Black people, and in particular Black men, at increased risk in the wider society. So in a way, there's almost an increased need for us to address our mental health, because we know outside society is not going to be as forgiving.
Yeah.
Honestly,
even something as simple as the tone of your voice, your volume. You could just be asserting yourself, as everybody has the right to, and you're the angry Black man. You could raise your voice to make sure you're heard, and you're suddenly the aggressive Black man. You could assert your innocence, or assert your point of view, your perception of how things are going, and you're seen as combative. And of course, once you start having those kinds of labels attached, then the potential outcome in some of those situations ends up being a lot of what we've seen in pop culture, in American culture.
So that actually reminds me of an interesting story that happened to me maybe my first year out of residency working in the family medicine clinic. And so we had a white female patient who had come back multiple times, sort of demanding that people order tests for her without actually coming for the appointment. And so I was the supervising physician on for the shift. And so I saw her multiple times and said, okay, well, we'll order the lab this time, but you really need to schedule a follow-up. You need to order a lab this time, but you really need to schedule a follow-up. And so finally, I think it was like the third or fourth visit, she came in and, I was just trying to be kind but firm and say, nope, we can't order any more tests. You need to see your physician because your physician needs to interpret this within the context of how you're doing and your symptoms. Expecting your physician to just interpret a lab result without actually seeing you and ordering additional tests if warranted is not fair to that physician, and it puts you at risk for a negative outcome. And so then, sure enough, about a couple of weeks later, the medical director for the clinic said, oh, well, I got a report stating that a patient felt threatened by your presence. And so at the time, going back to the sort of exhaustion, fortunately, she knew me and she trusted me, but I felt too tired to even begin to explain why that was the case, why she reported me, because this is just too long of a story. There are too many things that I have to explain to her, like why it happened. The next part of that story, though, was she said, oh, well, she said that, you talked with her a little bit in we have a nurse's station area, and then you took her to the counseling room for the rest of the session. And I was like, yeah, that's true. And so she's like, well, why did you start the conversation sort of in front of the nurse's station? And I was like, well, we weren't discussing any specifics. And, once we sort of got to the point where we were starting discussing actual medical stuff and medical details, we went into the counseling room. And so once again, the explanation I didn't really provide to her was, I knew that she would probably perceive this conversation negatively. And so I wanted some witnesses around. So then that way, if she did accuse me of being threatening, at least there are people who could say, okay, well, no, Dr. Gayle wasn't yelling at her. Dr. Gayle wasn't acting aggressively. And I think those are the things that the average person just doesn't have to deal with and doesn't have to navigate.
Yeah.
Absolutely.
I could agree with that. I mean, it doesn't really matter if it's social or even in a work environment. There are times when you absolutely have to be clear about your locus of control. And raising your voice or saying a particular phrase in this environment, the reaction is going to be, we need to call somebody because this person frightened me or this person threatened me. And that was never the intention, but it was to emphasize a point. Let's say something as simple as, if a request was not fulfilled and there's an urgency to it, I need you to do this now. That's not a threat. So that is to make sure that the person understands the urgency or whatever the conditions are of what you're dealing with. And yet I relate quite well to that example you just gave.
Absolutely. In many contexts, in many spaces, even, on more intimate spaces, it happens. I want to acknowledge something that Dr. Gayle said that I just thought was profound earlier. Just this idea of why Dr. Gayle and also Mr. Davidson, why it's important, why mental health is an important thing to just address in terms of Black men and Black fathers. It's just one of the things, or what they alluded to, is just the catastrophic consequences of not addressing it. I think that's what it amounted to for me. And as I was thinking about it, literally the consequences are dire when we don't, and have been, both from in our families, just because it influences how we parent as fathers, how we engage others, and also socially outside of the home, outside of our communities, outside of our safe spaces. It just can be sometimes the difference between whether we make it home or not. I just wanted to highlight that.
Well, truly, one of the, it's relevant to fatherhood, one of the most important decisions is who you choose to be a parent with.
Right.
And improper mental health and everything that surrounds it leads to decisions that can have lifelong dire consequences. I mean, you may be dead in jail or impoverished based on who you select as a partner. And a person can blame the other person, but the fact is there is a choice in deciding who will that other parent be.
Absolutely. We know a previous discussion that we had talked about the co-parenting dynamic, and I think it drew on that even at that point, there is that very critical need to be able to make those very informed choices. But again, going back to what all of you have talked about, when you have an individual, Black fathers in this specific case, who is as young as when they were kids themselves, carrying all of these double consciousness, where they have to make decisions in the quote unquote real world, and then also make decisions with the overlay of the additional world that they live in, the world of their skin, the costume of their skin that they carry every day, where they're carrying these double sets of rules and expectations. And then you overlay on top of that the additional rules of masculinity and what that means, and the very strong pull towards traditional masculinity. So things like restricted emotion. We talked about Black boys losing their joy and losing their smiles as early as 10, 11 years old. As soon as they get to 10, 11, these boys who were jumping around and enjoying themselves and playing and laughing, suddenly it's no longer cool to be laughing and showing your teeth. You can't do that as you're a man now. Being able to cry when something hurts, you're not able to do that anymore. You're a man now, so that you have to be able to beat this other person, whatever beat means, whether it be physically or academically or sports-wise. You have to be the best at this. You have to be better than everybody else. So all of these additional complications that Black men are carrying, and then you walk into that now, into this social contract that you've not signed, but you've signed just by virtue of being Black and male. You walk into the social contract of being a father, and now you are the provider and the protector of that child, provider and protector of the mom, provider and protector of the extended family, provider and protector of the neighborhood. And yet you're feeding all of this out, which is a lot of giving, a lot of psychic energy that you're giving. And you keep looking to see where this conduit is for receiving. There's this huge culvert out of which you're giving, pouring out of yourself. And there's a very, very small tributary that's flowing into you. And you're still expected to give so much, even when nothing is coming in sometimes. And so I think we talked about it, what that looks like personally for an individual. But part of the interesting piece of doing this podcast series is that we're hoping that providers and others who work with families are going to use this. And so as we think about this, I'm going to ask you to respond first, Darryl, because I know you swim in the pool of policy. What kinds of mental health policies or programs exist, and if any, what supports are there for Black fathers? I know you probably have a lot of them in Milwaukee.
Well, we do, and primarily that's in the realm of Milwaukee County. But I do want to share, as we're on this topic, that policies have shifted so that there are more online services that are available. I wasn't sure if I should advertise what specifically are there, but for those of you who are watching across the country, please make sure to take a look at your local hospitals as well as your other systems of medical care, and find out if they are the ones who have the behavioral health centers and other mental health facilities that have an online component. At least locally for us, fortunately, the rules have changed so that there can now be a telemedicine version of mental health interaction, as well as continuing education and larger sessions where the public as well as service providers can join and learn what is available to them. So it's a great source for referrals, as well as it's an avenue for people to access care in the types of times that we're living in.
Most recently, I did with some men and some fathers in Black fathers in Milwaukee. And one of the things that they kept mentioning was that very often a service would pop up that was father friendly or father serving. And in about a month or 2 or 3, that service would disappear. So not only that services often aren't available, but when they are available, they're usually short-lived and they're also difficult to find. And so I think you're saying that there seems to be this catchment area for services that fathers could go to a one-stop shop and get some of these services that might be available.
That's true. I think the benefit, if there are any, of going into and learning about how people responded to the pandemic is that they recognized there were people who were isolated long before there was a lockdown. And we had to provide services for those individuals. Now we're able to create a structure to those systems that can do it.
Yeah. So Dr. Gayle, I know that you served as a government and practice advocacy representative for the Pennsylvania Academy of Family Physicians. So wearing that hat, what are some of the mental health policies or programs that exist? And if not, or if any, how do they support Black fathers?
Oh, wow. So I guess that's harkening back a few years there. I don't know about specific policies. I can refer to like different programs. Right. So I would, for example, say for individuals seeking care coming from the primary care side, there are primary care entities, whether they're through hospital systems or federally qualified health centers, et cetera, that do include therapists, behavioral specialists. And so, like you said, if you're truly seeking out like a one-stop shop, seeking out primary care entities or clinics that include behavioral specialists is incredibly important. I think, as already was sort of mentioned, a lot of the reimbursement policies have changed where now telemedicine is more readily available for a whole bunch of services. So I think that's been a big change. I think also trying to find community-based mental health organizations is also incredibly important. So I know back when I was in Pennsylvania, we did have a community-based mental health organization with whom we would partner. And in fact, my old program, they actually do a lot of their addiction medicine care in concert with that entity. Sort of moving on to Maryland, actually, one of the things I'm doing now today is actually working with one of the county health departments in providing telemedicine, mental health care, and there are other community-based organizations. So I would say trying to see what either primary care clinics include behavioral health care for basically reimbursement and insurance purposes, or finding what community-based entities are available and covered by your insurance. The other thing to consider are organizations that provide therapy services in like a group setting. So I know a lot of my patients pre-pandemic would go to group sessions with the National Alliance for Mental Illness, because they would have various groups throughout the region, and they would try to sort of seek out a group whose composition sort of more closely resembled sort of what they were looking for. And some of the descriptions of the group would actually sort of go into greater detail about the general population that was sort of being sought out for the care.
So this is our penultimate question, and I'll throw it at Eric first. I'll ask Eric to kind of, for the dads who are listening in and wondering, how can I normalize mental health for myself, as well as for my immediate family and my extended family? What would you tell them?
Yeah, I'm glad you asked that, because it was linked to the previous question, in the sense that I wanted to acknowledge just how you mentioned, but just it is difficult to find services. Those services are available. But one of the things we do know is that even among therapists and psychologists, there's still a small percentage who look like us. So that definitely makes it challenging. Engagement among Black men specifically is still low. And I think some of that has to do with those, the lack of diversity. But then this idea of normalizing. I think first, from the professional clinical perspective, we have to accept and be okay with how Black men start from a point of how Black men discuss mental health. It may not be in the way that we are trained to hear it, but we have to train ourselves to hear how it's connected, how they may even ask for help or seek help. It may be so indirect. I'm saying this as a male and a Black father myself. Sometimes it's not direct, but we have to train ourselves as clinicians and as practitioners or individuals working with Black men and families to catch it and to read, in a sense, between the lines. Also, while we're educating those families or Black men to speak more assertively and directly about it. As a Black man and as a Black father, I think the best thing you can do is normalizing conversations around emotions. I'm learning, and one of the things that has worked in therapy, sometimes being a little bit more direct, kind of putting pressure on, being direct, identifying as discussing something explicitly, and then being able to say and acknowledge where you may feel uncomfortable, or where you putting up boundaries like, okay, I've said enough and I'm going to stop right there, and being okay with that. I was just communicating with someone working with their brother, or trying to communicate better with their brother, with a Black male. Sometimes you say a thing and then let it go. It's kind of like gardening. I'm not a gardener per se, but I think there's a process of seed planting and nurturing that happens. Right. And I think that's one of the things we as Black men can do for ourselves within our family, and do for other Black men who in our networks, kind of plant seeds and nurture it. But if you we don't respond well to smothering of a thing, and plants don't either.
Right, exactly.
So that's what I would say, to normalize it, really just taking the time to plant seeds, nurturing it within our families as Black males, and even with ourselves, taking small steps. Don't promise things to yourself that are unreasonable. Like, you know what, from now I'm going to be vulnerable with everybody. No, take small steps. I'm going to find me a person and I'm going to share what I can and leave it at that. And as you grow, you add more challenge to yourself and more tools.
So I'll come in next, because that was the clinic that just called me, so I gotta go. But I think the key word that I was going to go back to as well was sort of vulnerability, and sort of modeling vulnerability to our families. Like was just said, obviously we're not going to be vulnerable to everybody, because its own risks. But and I think what we have to show our kids and our families is that it's okay to be vulnerable. I remember when Dr. Thomas was talking about like the culvert versus like the small trickle that we're receiving. What I thought about was also part of it is that we're also not open to receiving the little that we do receive. Mm-hmm. And so I think part of that vulnerability that we have to model for our families and for our children is sort of modeling the fact that we aren't perfect, and that we're sort of learning how to cope with things as well. And so I think one of the things that tends to be sort of stigmatized oftentimes in the Black community is apologizing to our kids when we don't handle it well, or explain to them sort of how we felt in that moment and how we were processing it. Now, obviously, we're not placing all of our burdens on our children, but there's no other way for our kids to learn how to manage these things unless we're explaining to them when we do things right, how we did them right, and then when we do things wrong and why we did them wrong. My 4-year-old and we were outside yesterday, raking up the leaves. He doesn't know how to hold a rake. He doesn't know how to hold a broom. Somebody has to show him what the proper technique is. And I think that's something that we as fathers can do, is sort of model that vulnerability with our children, but also model that we do have trusted people in our lives with whom we share our feelings. So that would be my 2 cents. But it was great talking with all you guys. Sorry that I have to go for clinic, but this was a really, really great time to spend with you guys.
Excellent. Thank you so much, Britt.
Thank you. Nice meeting you as well.
Thank you. Thank you for participating.
So this actually leads perfectly. I think Britt had some really great practical pieces of advice and experiences to kind of share. And so I think for the final question, it's combining that last question and this final question, which is, what are some of the maybe 1 or 2 pieces of practical advice you could offer to fathers? So fathers who are listening, something that they could go home and say, you know what, let me go try this. I'm going to try this for the next week.
The first thing that I would share with fathers is that every father has a purpose, and that purpose does not have to be something that someone told you this is what you are here for. So know yourself, know what your interests are, have passion about your interests. And don't forget, there's already been these other people who are passionate and successful. I mean, there's already been a Miles Davis and a Michael Jordan and a KRS-One and a Denzel Washington who show themselves to be Black men who are the best at what they do. But the fact is, that does not have to be your wheelhouse at all.
Mm-hmm.
I mean, even the example that we just heard about, if a child doesn't know how to hold their rake, and that is your son or daughter, show them how to hold the rake and show them how to rake leaves well. Mm-hmm. That is a purpose that we have. Nurturing the next generation, mm-hmm. making sure that they're protected and that they have optimal mental health, and that you can be their source of security if they have fear or if they have questions. That's a purpose. Mm-hmm. And so it doesn't have to be anything elaborate and world-changing. Mm-hmm. Just know, if you're a father, that the fact that you're a father, your children are ready to show you that respect. Just don't be so hard on yourself. Yeah. And finally, if you need help, we have organizations like ours, the Milwaukee Fatherhood Initiative, that exists very likely in your state. Please look them up. Talk to people who are in social services or in health professions. Find out where they are, even if what it turns into are phone conversations, but make something happen so that you can be the best that you can for your family and your loved ones.
Excellent. Thank you so much for that, Darryl.
I just love what he said. So I'm like, what do I add, right? Just to put emphasis on, he said, don't be hard on yourself. I just want to emphasize that, be compassionate. And the thing that I would add to that, for fathers, and so many things I think I could say, I think the most important thing I feel like the most important thing I would say is be willing to seek help even when you don't think you need it or have been taught that you don't need it. I think one of the biggest challenges we face is not necessarily recognizing our need for help. I think it's trying to convince ourselves that we have to do it on our own or have to do something and handle something independently. And I think if we let go of that idea or relax it a little bit, we'll start to seek help in places where we wouldn't have imagined help could be beneficial. I'm learning that one, as a husband and as a father, that even though I imagine I could do a lot of things on my own, I don't have to.
Right.
I don't have to, and we don't have to. And honestly, you just do things more efficiently with help sometimes. So yeah, I would say just seek help even when you don't believe you need it or think you need it.
I think we're so good. Again, it comes down to that unspoken social contract. We're so good at providing assistance for everybody else. We're ready to give help to everybody else. But when it comes to us, no, I'm good. I don't help with that. I can take care of that. I'm good. I handle mines. I handle my own. I take care of my own. But somebody else needs help. Oh, no, you don't have to carry that by yourself. I'll help you with that. I'll give you some money. I'll listen to what
I got you.
Exactly. But nobody needs to get me. I need to get everybody else. just really, really interesting. So again, I appreciate your time, your experience, and your expertise. You've given us some really important pieces of wisdom and some great practical advice about how to expand our understanding and the conversation about mental health, especially among Black men, but among Black fathers by extension. We want to continue to build on this wave of centering Black men as people first, as human beings with their own stories, experiences, and emotional lives, and then thinking about how that many social roles affect them and those whom they love. The stories that we often hear about Black fathers are often from a deficit lens. What others think Black fathers are not doing, and the myth fathers are not present or are uninvolved. We want to educate Black men, validate them in and out of their roles as fathers, and elevate them and the great work that they've been doing supporting and loving on their children and families. This has been another episode of the Black Fatherhood series. Thank you.
Thank you.
Thank you for listening to the Black Fatherhood podcast with Dr. Alvin Thomas. If you enjoyed this episode, please share it with your friends on social media or post a review online. Thanks again for being part of the conversation.